Hello, everyone, and good morning. My name is Emily Kosick, and I am the Knowledge Manager for the Canadian Institute for Public Safety Research and Treatment. Welcome to today's session, Fundamentals of Sleep. Before we get started today, there are just a few housekeeping notes that I want to go through. First of all attendees are in listen-only mode. This is to limit feedback and noise. Today's session is being recorded. You'll be sent a copy tomorrow, so if you miss anything, you can watch it again. The GoToWebinar launch window can be blocked by some organizations, so if you're having trouble hearing or seeing, you may have to join us by phone. We will be looking for audience questions at the end of the session, so please send us your questions throughout using the question box, or be ready to raise your hand and ask your question during the question period. Now, I am very pleased to introduce our speaker for today, Dr. Carney, a professor at Ryerson University and a director of the Sleep and Depression Laboratory there. So I'm going to turn it over to you, Dr. Carney, to get started.
Okay, wonderful. Well, good. Is it morning for you? I don't even know. I think it's morning for you. I don't even know what it is for me, actually, but it's just one of those, it's a strange time. I'm really happy to be here with you. The intent of this was to really give you some information about the fundamentals of sleep. We have some lofty goals here, but before we talk about what I'm going to talk about, let me start with a quiz. Can't really interact, but I just want you to keep in mind what your answer is. How important is sleep to you? Not at all important, somewhat important, important, very important. Although for some people, I feel like I have to add there is nothing more important to you than sleep. I think I could get many different responses to this quiz depending on who I'm speaking with. And I think it shows us the sort of range of opinions and how people value sleep or don't. And I always say that I think that we need to sleep to live. That is true. So we need to prioritize it. But we don't want to live to sleep. We don't want to over prioritize, which is something that happens in insomnia. So I'm going to talk about the whole range of sleep as we know it. So my approach today was really to talk about the fundamentals of sleep, to give you an idea about what sleep behaviors you may want to prioritize. I also think that knowing how your sleep system works helps you leverage it and helps you adjust what you're doing. I also want to give you a lot of information about sleep and sleep health that allows you to make good decisions for yourself. There's a lot of misinformation and myths out there. One myth we'll talk about is that all adults need 8 hours. That is definitely a myth. So trying to debunk some of the things that we've heard. I'm going to give you some tips about how to know if you have a sleep problem and what treatments we know to be effective. So that's a lot to cover in an hour or a little over an hour. So some of this is going to be just scratching the surface. The hope is that I'll come back another time and go into some very specific problems and give you some very targeted solutions. So I'm going to approach this as categorizing sleep problems in two different ways. One is a problem with sleepiness. Sleepiness means that you are sleepy during the day when you should be alert. And so the way that we would define that is that you fall asleep involuntarily during the day, unintentionally. Now, this could be like kind of nodding off or dozing off, having little cat naps. It could also mean that you need to nap in order to get through your day, which is something that shouldn't have to happen in an adult. So these are incredibly important problems because there's a lot of safety and health issues associated with sleepiness. So we'll talk about that first. But before I do, just to show you that later we will talk about something called sleeplessness. This is something that we really think about with insomnia, trouble falling asleep at the beginning of the night or the middle of the night, waking up a lot earlier than you intend to, and then just feeling tired. So being tired, cranky, mentally cloudy, those sorts of things is not the same as being sleepy, because sleepy is you literally do fall asleep during the day. So they're two different things, and you might think they're the same, but there's actually a reason to separate them. Now, I always feel guilty showing this, especially first thing, to show this depressing sleep duration and death. I'll try and make it happy for a second. Well, I mean, I can make it a little bit happy because here's the deal. So if you're somebody who regularly gets somewhere between 6 to 9 hours, then all of the gloom and doom of this graph doesn't apply to you. So let's go through all the scare tactics that you hear so often. If you regularly sleep less than 6 hours, the chances that you will gain weight, become obese, or get diabetes are greatly elevated. That you'll have an accident, and you're more likely to have a fatal accident too. Heart attacks, cognitive disorders, dementia, cancer, that's pretty specific, stroke, high blood pressure. These are a lot of the gloom and doom findings that we know when you sleep routinely less than 6 hours. People with insomnia hear this and are very worried. People with insomnia typically do not sleep less than 6 hours on average. There are a small group of people who do, but usually there are some nights in which they sleep longer, which pushes them into the normal range, the low normal range, and they forget about those nights. They only focus on the really low nights. So most of this research right here does not apply to insomnia at all. Now, if you sleep more than 9 hours on average, there's actually risks associated with that as well. We don't understand as well. And it does appear to be, it might not be that you sleep more than 9 hours, but you're in bed more than 9 hours. So time in bed is greatly increased. Now, certainly there's a risk of developing mental health issues. And certainly insomnia, if you spend more time in bed, the chances of you developing insomnia are pretty high, having inflammation and all the problems that go with inflammation in the body. So you sleeping too little or too long chronically do have health concerns associated with it. So how do you know if you're sleep deprived, if you're sleepy? One is that you fall asleep unintentionally. That is our definition of sleepiness. So during the day, do you do the kind of, this kind of thing? I look out into a sea of student faces that are, and I know it can't be me. I'm a very, very exciting lecturer, so it must be them. If you fall asleep, this is a myth busting moment. If you fall asleep in less than 10 minutes of lying down routinely, less than 10 minutes, you are sleepy. It means that you probably could benefit from more time in bed, or that you have an underlying undiagnosed sleep disorder. We should take somewhere between 10 and 30 minutes to fall asleep, believe it or not. Another myth, that you should not wake up, and you should not wake up during the night. If you do not remember any awakenings at all during the night, it means that you're probably a little sleep deprived. We wake up many, many, many times per hour, and we usually get up once or twice in the middle of the night. It's normal to get up to 2 times to pee, in fact. And then another sign of sleep deprivation is that you need a nap every day. This is sort of the sleepiness issue. So, okay, what's going on with sleepiness? I replaced a swear with life happens instead. So stuff happens. You can have a short-term, maybe long-term, environmental demand because of your job that takes you away from being able to prioritize sleep. When that happens, I can't get into a tremendous amount of detail right now, but we are going to focus on this in future webinars. My advice is to maintain whatever good sleep behaviors you can that we're going to be talking about, and focus on other good health behaviors, eating and so on, eating 3 healthy meals. You can use compensatory naps for safety and alertness when you can. And when we talk about fatigue management behaviors later, those are probably good for you to do. So kind of tricky. Now, there's another group here who we call voluntary sleep restrictors. These are people who think that they should forego sleep to get more done. They're who I label, there will be time for sleeping when I'm dead. Here are some famous sleep restrictors with some famous illnesses. But these people really have these false beliefs about the consequences of sleep. They view, when they can cope with the symptoms of sleep loss, they believe they've adapted to sleep loss, which is not true. Their bodies will break down. They're just doing a good job coping with it. And so they continue to overschedule their lifestyles. Here are just a few of the unhappy results or adverse events associated with it: memory problems, learning, metabolism, immunity, and mental health issues. These people also make poor judgments on the job. They might make more risky choices, interestingly, and engage in more ethically dubious behavior as a result of sleep deprivation, which is very interesting. Then there's the whole pleasant obesity, type 2 diabetes, heart disease, high blood pressure, cancer, and death. Now, thankfully, there is a cure. Please stop it. You just have to get into bed a little bit more often, and suddenly this dreadful disease is gone. I'm being a little trite here, but what I would say is that if you're going to make a health behavior change, whatever it is, eating, exercising, sleep, prioritizing sleep, there are some strategies that tend to work. I mean, one is to start off by focusing on what it is that you want. What would you gain by making the change, right? So a longer life, more energy, preventing serious illness, modeling healthy behaviors for your kids. There could be a variety of things that you would value. So writing those down, in addition to coming up with a realistic goal. Many night owls will shame themselves into trying to get up earlier when their body doesn't really support that. And they set unrealistic goals. So if you're going to try and rise earlier and you're a night owl, you're going to have to do it slowly over time and consistently. The other thing is just expect that there's going to be things in the way. Try and think of what they are, try and come up with a plan. And when you have setbacks, and you will, have a plan for getting back on track. Now, there are other causes for sleepiness. One of the most common one is sleep apnea. Now, the risk for sleep apnea increases as you age. So people in my age range are at increased risk for a variety of reasons. I hope to be able to do a webinar just on this, but this is a decent screen for whether or not you should be talking to your doctor. If you snore loudly and persistently, like most nights, that's a risk factor. If you fall asleep involuntarily during the day or need to nap in order to get through your day, that's sleepiness. Has anyone ever seen you stop breathing in your sleep and commented on it? Do you have high blood pressure? Do you have to get up to pee more than twice a night? If you had 2 or more on this list, this is enough to really talk to your doctor, because getting apnea treated will lengthen your life and improve the quality of your life as well. It is a silent killer. Here's all the unpleasant diseases that it directly causes. So it is essentially a breathing disorder in which you stop breathing for 10 seconds or more at a time, 15 times or more per hour. You're cut off from oxygen, and your brain has to wake you up in order to resuscitate you, and you may or may not be aware of the resuscitation. And so it really creates tremendous sleep deprivation that you may or may not be aware of. And it is by far one of the deadliest killers we have in chronic illness. Shift work, which I know many of you are probably familiar with. Anything in the sleep deprivation literature, all the sort of negative things that I talked about, apply to you, unfortunately. They are more prone to accidents, disease, and early death. Cancer specifically is a big problem. So in many large studies, there's an increased rate in cancer. The World Health Organization wanted to label shift work a carcinogen, a cancer agent. There's some controversy associated with that, but there definitely is a lot of links between cancer and shift work. It's difficult for us to treat people with shift work with things like melatonin and light therapy. The best thing for us is to try and come up with a schedule to try and trick your body, and it would ideally be done 7 days a week. But unfortunately, our patients are humans, and humans have lives, and so it's pretty pesky for us, because usually on days off they actually want to act like humans, and also their work schedule changes as well. So protecting people from the negative health issues associated with shift work is really hard for us. So what I would definitely do is use naps for compensation to keep you safe so that you're alert post-nap, but talk to a professional. So somebody, a sleep doctor specifically, and one preferably at a chronobiology center. I'm going to talk to you about resources on my last slide. So you may wonder if you can compensate for sleep deprivation. So you can't prevent the illness that would be associated with chronic sleep deprivation, but you can deal with the short-term effects. So naps are one of those things that you can use. It is a temporary fix, and you don't even need a long nap in order to help you. And what it does is it increases your alertness post-nap. Now, one thing that kind of is tricky is that you can wake up in a deep stage of sleep from the nap, in which case you would be groggy. We call it sleep drunkenness, which would suck because you nap to feel more alert. But you probably, once you shake off the grogginess, you probably will be more alert post-nap. I'm going to talk about why naps are really bad in insomnia, though. So this is specifically sleep deprivation that I'm talking about here. The earlier in the day, the less sleep disruptive it is. You might say, wait, they're sleep disruptive? Yeah. Naps are not a good idea for sleep. They're a good idea for post-nap alertness. So the briefer they are, the better. David Dinches has this saying that we nap for sleepiness, not for sleep. I just think it's a brilliant way to put it. We nap for sleepiness to get rid of the sleepiness so that we have enhanced performance afterwards. In your lines of work, it's incredibly important. But we're not going to nap for sleep, because napping takes away from quality of sleep the subsequent night, so that night. And also napping is helping with sleepiness in a temporary way, but it still is going to take its toll, the sleep deprivation. So it's really tricky. You may wonder if exercise is helpful for sleep deprivation to help in the moment, the short term. And there is some good evidence that even a 5-minute walk would kind of shake off some of the cognitive, that muddiness, the mental and physical muddiness that sleep deprivation causes. Of course, there is like this trade-off. So if you had really vigorous exercise, some people feel sleepier. So you'd really have to experiment with what made you feel good. Now, another way that people do try to compensate for sleep deprivation is to use cold air, right? To blast the AC as they're driving to the emergency or whatever, or open the windows for alertness. Myth. So that does not. Now, interestingly, when we test people on the driving simulator and we allow them to, after they've been sleep deprived, and we allow them to, blast cold air in their face, they will tell us they feel better, they're more alert, and meanwhile, their performance on the driving simulator, they're like swerving lanes, they're like killing people, they're doing all this stuff on the driving simulator. So it's subjective. We believe it helps. It doesn't. Now, bright lights, turning on all the lights, does that help? Try to increase alertness? Yes, absolutely it does. Again, there's a point of diminishing return where your eyes can fatigue and then you'd feel sleepy again. Does posture help? Yeah. Sitting up or standing up. If nothing else, it takes you longer to fall asleep if you're going to fall asleep involuntarily. So it's a way to kind of shake it up. Walking around can help. Do stimulant drugs help? Sure. Yes, they do. The withdrawal is increased fatigue from them, and there are all kinds of downsides to these medications. So we sometimes use some stimulant medications in people who have chronic sleep deprivation, and certainly many people use caffeine. But there's sort of a pro and con for using stimulants. All right, so let's finish this off with the idea of what do you do when you're sleepy? Well, if you're sleepy and you know it, and you know why, try to address it. It's a very important illness factor. If you're sleepy and you don't know why, then that's really important to talk to your doctor. They need to assess for disorders that we need to do an overnight study in order to figure out, right? Things like, limb movement disorders and narcolepsy and sleep apnea. We don't know unless we see you in the lab. So that's something that we probably ought to do. Now, I spend most of my day talking to people about sleeplessness, insomnia. And people with sleeplessness are worried about all the other slides I just finished talking about because they think it applies to them. And if I watched the news or read magazines or on the internet, I would think that too. But the reality is something happens once insomnia turns chronic that tends to protect you from a lot of those disorders. So how does that happen? Well, the fact of the matter is that sleeplessness happens to all of us at one point or another. It could be, it could be anything. Anything can disrupt sleep, right? Just every once in a while, right? So if something disrupts sleep, no matter what it is, and whether it be that you have post-traumatic stress disorder, you had a let's see, you're having a hot flash, you're in menopause, you're having chronic pain, out of the blue, something stressful, literally anything. You broke your leg and now you're recovering and it's uncomfortable. All of these people have the same thing that they need to do, and that is to cope with the sleep loss. Now, interestingly, people tend to cope with sleep loss in very similar ways. They tend to maybe drink coffee during the day to manage it, nap, hit the snooze bar a couple extra times, maybe go to bed early, cancel things to take it easy, drink alcohol or smoke weed before bed just to wind down. All of these things are pretty reasonable, but all of them have the possible negative effect on the systems that regulate sleep. So many of these behaviors I just described could negatively impact the system that actually controls how much deep sleep you get and how much you recover from lost sleep. It can negatively affect your body clock, or it can create what we call hyperarousal, right? So certainly people who are in emergency type careers, they report something called on-call sleep. Many have trauma, and which increases their alertness and vigilance. And once you have some momentum in your temporary insomnia, chronic insomnia disrupts the association of your bed with sleep. So these are all the things, these three things are the three things that cause chronic insomnia. So let's break down those three things. Let's come up with some solutions. Let me just check my time here. Okay, we're doing well. Okay, so to be at the ready takes a certain amount of attention, vigilance, arousal. Your body, your mind has to be at the ready. So once the emergency is over, it is difficult to come down from that for some people. Or more than that, what if you're on call? So you're allowed to sleep, but you don't know if you're going to get called. Your body, your sleep when you are on call is different from the sleep you get when you are not on call. Your body knows that you could be called. So how can you sleep in this state? Not well for most people. So I don't know if that applies to you, but we know that when you're on call, you're not going to sleep particularly deep. You're going to be very alert, and this can create some problems. So there are some strategies that we can talk about. I don't have really time to get into them, but some of the ones that we will talk about today would be helpful for this. But you basically need some strategies to create quality sleep even when you're on call. Another problem that we see is what I call the switch. Okay, so the switch is, okay, I'm not on call. I am ready for bed, and now I'm gonna get into bed. I feel so tired. It's so good. I'm gonna sleep really well. I lay down my head, and it's like a switch went off, and I am wide awake. So totally ready for bed the second before I get into bed and I close my eyes, a switch goes off. If you have that, you have what we psychologists call conditioned arousal. And here is the nerdy way of explaining it, because I am a nerd. Remember Pavlov? I'm sure you've heard of him, famous for an experiment in which he shows, look, you show a dog meat, they drool. You don't have to train that. If you pair showing the meat with a bell over and over and over again, you can actually get rid of the meat and just ring the bell, and the dog will suddenly drool to a bell, and they shouldn't, right? It's because they have made an association outside of their awareness, okay? We are no more sophisticated than that. If we pair our bed over and over again with wakefulness, we will train ourselves when we get into that bed, whoop, awake. Literally that simple, and it's outside of our awareness. So we need a strategy to get rid of that. Now, I'm not trying to peck on cat owners here, but I do find it particularly funny. This is a cat's map of the bed. So here you can see the foot attack zone, the launch pad to the dresser, the heaving spot conveniently right next to your head, the yoga and stretching studio. This is all to say, is your bed and is your bedroom conducive to sleep? I don't mean, it doesn't have to be a shrine to perfect silence and perfect sleeping quarters, but if you've got all your work all over that bedroom, if your bedroom is a complete mess, if you've got like pets and kids and like just all kinds of stuff going on, and you're doing work in bed and eating in bed and whatever, then you can inadvertently train yourself to become awake in bed because it's associated that way. Now, I toyed with getting rid of replacing Alex's picture, but I just can't. He's just too quintessential when I think about Jeopardy, so I'm going to keep him on here. So sometimes we play a game of what I call cognitive arousal Jeopardy every night. So here are the categories. Tell me if you play along as well. There are no winners of cognitive arousal Jeopardy, no champions. The categories are ways in which people have wronged me, strange noises, diseases I probably have, my endless money troubles, why did I say or do that, or ideas for a screenplay. So you can see they're not all negative. Some of them are inspirational, but you're not going to sleep if this game is playing. So you're going to need a strategy for that. Before we talk strategy, let's understand our body. Let's also check the time to make sure I'm cool. Yeah. So one of the systems that we have that makes up for lost sleep that you should understand makes up for lost sleep with deep sleep, not with more sleep. That is a fundamental error that most people make, because when they have a bad night, if they don't sleep more the next night, they assume their body hasn't recovered. And so they may then attempt to spend more time in bed to produce more sleep, but that's not how it works. So let me explain how it works with this very scientific graph. So we need to build a sleep drive throughout the day with physical activity and time out of bed. That way we build up a chemical that's associated with sleepiness so that by the time we go to bed, we have enough of it that we are going to sleep well. If we're very physically active, then we will build up more of that chemical. If we have to stay up later because we're on scene of an emergency or whatever it is we're doing, we will have a greater deep sleep drive. And we will have greater amounts of deep sleep, even if we don't sleep longer. Now, why does that matter? Because deep sleep equals release of growth hormone. For those of you who work out, you know what growth hormone is. It is the thing that restores our tissues. So we need it. We need to provide this build of deep sleep drive. Now, if we think we've had a really long, we were up really late, and so we expect to sleep in more, and we wake up at our normal time, sometimes what we'll do is we'll try to sleep in, whether it's successful or not. But what that essentially does is it subtracts time out of bed and time where you are inactive from the next night's buildup of that same chemical. So by the time you're ready to go to bed, you're in the medium range for deep sleep drive, which means that it might take you longer to fall asleep. You may wake up more frequently, and more importantly, you won't have a lot of deep sleep. So tissue restoration wise, you're not going to feel as good, and you might feel achy, for example. So sleeping in is not really a great strategy for somebody with insomnia. What about naps? I talked about naps being helpful for people with sleep deprivation. They are not helpful for people with insomnia, and I'm going to explain why. People with insomnia have a low deep sleep drive because they tend to go to bed early sometimes, they tend to sleep in sometimes, they cut back on physical activity, they tend to nap or attempt to nap, or same thing. So what do? So they build up a little bit of this deep sleep drive, build up a little bit of the chemical, and then they attempt to nap. They may or may not be successful during the nap, but let's say they did. So they feel a little better. So it's reinforcing, like, oh, I feel a little better. The amount of deep sleep that's produced in that nap is exponentially related to how much deep sleep you can produce that night. So even if you only got a few minutes of deep sleep in a 10-minute nap, in somebody with insomnia, the amount of deep sleep that you would lose and drive you would lose that night is much greater than 10 minutes. And considering that usually 20% or less of our night is made up of deep sleep, that makes a big difference. So unfortunately, by the time you've now wiped out some of your sleep drive, so by the time you're ready for bed, you don't have enough to sustain yourself throughout the night. It may take you longer to fall asleep. You may wake up in the middle of the night. You may have poor quality sleep. So I think of naps like cupcakes. There's nothing wrong with a cupcake, but cupcakes in the context of diabetes take on us a different meaning, a different consequence. So naps we're going to use with sleep deprivation, but in chronic insomnia, we are never, ever, 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 ever going to use them because they have a deep sleep drive problem. So naps are different for them. So we're only going to nap for sleepiness. Now, the second thing that we should understand is that we are a clock. Now, on some level, you know this, right? You know this if you've been a parent, hopefully if you've been parented, or if you know somebody who's currently parenting a young kid. Parents are pretty protective of the routine, with young kids. Why? Because they know that sleeping, eating, mood, everything gets thrown off when Junior is off their schedule. Now, I understand that people think that this is just a developmental thing that we outgrow, but this is genetic. We do not outgrow being a clock. We are a clock. We, in fact, have a steady signal that emits over a 24-hour period, a reliable rise and fall. And here is a graph of a rise and fall of our alerting signal that's chemically derived, that is really low in the morning, starts to increase and reaches a peak in the kind of mid to late evening, and then falls. Now, why does this matter? There's many reasons. One is that if you're going to go to bed early, you may be going to bed at a time that is in direct conflict with the highest peak of your alerting signal. So you may have a hard time falling asleep at that time, or you may be able to fall asleep. But as soon as that cycle is done, an hour and a half or so later, you're going to wake up and be awake for hours. That's a problem. What you want is you want to go to sleep a couple of hours after the peak. The peak is associated with the release of melatonin. Melatonin is a signal that many hours later you'll be able to fall asleep. It's not a sleeping pill, by the way. And so it affects the alerting signal, so it starts to recede. And then a couple of hours later, that's, when it's more in the medium range, the alerting signal, that's when you want to attempt to sleep. You can see in the first half of the night, the alerting signal is still medium in terms of its strength. So you really need that strong, deep sleep drive in order to override that alertness. In the second half of the night, the alerting signal is basically gone. That's why some people, particularly with post-traumatic stress disorder, find it easiest to attempt to sleep at this time because they're aware in some way that the alerting signal is gone. And it's easier for them to sleep. But it's also, if you sleep during those hours, and that's where most of your sleep is, you don't get the quality of sleep that you want, because during that time, it's mainly, rapid eye movement sleep, which is not a deep sleep. It's actually more like wakefulness. So somebody like me can help you work out how to fix that problem. Now, another problem, here's shift work, right? So you worked all night and you decide to go to bed here in the morning. You are sleeping at a time in which your alerting signal is getting stronger and stronger and stronger and stronger. So many people will report that they are able to sleep for shorter durations when they're working shift work. Now, another thing that most of us do is we think that we're really regular. We're like, oh yeah, I go to bed around 11, I get up at 6 every morning. I mean, that's usually not true. As you can see, it's not true for this person. When they get into bed, they don't go to bed at 11. You can see that they set the alarm for 6 5 days a week, but they have a friendly relationship with the snooze bar. And there's definitely no alarm on the weekend, right? So they are not as regular as they think they are. And if we're clocks, what does that mean? It means that our mood, our alertness, our ability to sleep normally, and even our eating and what our efficiency with processing food and insulin is going to be off. Now, what this means is we should have some regular activities in our week to the extent that we can for healthy sleep. And many people do this. They go out on a Saturday night, which is great, but then on Sunday they decide to get it together and go to bed early, even to get back on track for Monday. But this creates a 4-hour difference in the timing of when they're going to sleep. And doing that is the same as traveling without traveling. So it's jet lag without the scenery. That's a 4-hour difference. That's Halifax to Vancouver. Yeah, 4 hours. So, have you had jet lag? You have difficulty sleeping when you want. You have difficulty waking up when you want. You feel groggy during the day. Your eating is off. You're moody. So a lot of what we blame on Monday is actually related to jet lag without travel. So we want to create some regularity. And this is usually even more exaggerated with when you wake up. Most people tend to wake up somewhat regular during the week, depending on what the nature of your job is, or some people that's not the case at all. And on the weekend, there could be like this copious sleeping in. So here, this is a 5-hour difference. This is a trip to Europe. And you wouldn't expect, the sirens are always right on cue when I'm trying to do a webinar. You wouldn't expect with a 5-hour travel that you would be yourself, that it would be optimal, right? So so we have to try to establish some regularity. So what are the effective treatments for insomnia? Medications work. I know there's a lot of negativity about sleep medications. I understand that there are a lot of problems with them. I mean, in older adults, we don't like to see it because of falls. They can stop working for people. You can get rebound insomnia. You have parasomnias, meaning that you can have sleepwalking, or something called sexsomnia, where you have sex without your awareness, which has a lot of issues associated with that. And it doesn't actually address the cause. And there's some possible medical health related side effects too. So I totally understand that, but I do think that it's helpful to talk to your doctor about sort of a cost-benefit analysis and to see if they would be helpful for you. They are supposed to be short-term for you take it every night for 2 weeks and then stop. That's what you're supposed to do. Some doctors don't prescribe it that way. Some doctors also use off-label drugs that don't work. I won't say which ones they are, but I've given you some examples of ones that are approved and are effective. Melatonin is not effective. It is not a sleep aid at all. But interestingly, if you have chronic insomnia that is there most nights and has been there for 3 months or more, then the thing that you're supposed to try is actually a therapy, believe it or not. I say a therapy, but a lot of it is really just determining a good schedule for you and some other tricks. It's not a therapy in which you're talking about, your past and getting into some deep things. It's actually just very problem focused. It's called cognitive behavior therapy for insomnia, or CBTI, and it's as effective as drugs, but it's more durable and it doesn't have the negative side effects. It's incredibly brief too. Some people believe that CBT, because your work is working on beliefs and behaviors, that it implies that you're doing something wrong. No, it does not. The things that cause an insomnia to become chronic, I talked to you about in terms of like just being awake can pair your bed with wakefulness. That's not anything you've done wrong. And that's, it's absolutely false that insomnias are the fault of somebody with insomnia. That's not the way it works. It's something that sets up over time. So what it is that we can teach you some cognitive or behavioral tricks to leverage your sleep system to get it working again. So one of them is to reassociate the bed with sleeping, to get rid of that switch that wakes you up, right? To get rid of the conditioned arousal, to teach you what are some good ways to send regular input into your body clock so that you have better input to sleep when you want to wake up when you want and to feel alert when you want. So coming up with a good schedule, how to increase deep sleep drive so that your body naturally compensates for sleep, because sometimes we get in the way with it. The other thing is that we need to challenge any beliefs that get in the way of just normal sleep. The biggest thing that we're challenging is the idea that you need to do something in order to sleep. Healthy sleepers, if I ask them how they sleep, they laugh. They're like, I don't know, like I close my eyes. Sleep is effortless. So when we have all kinds of rituals and conditions in which we need in order to sleep, then something's up, and we can fix it. So, but one of the things that we need to do is to start trusting our body again, and learning quiet your mind and relaxation skills. For some people on this webinar, there is more to it than just this, right? So there might be trauma, there might be all kinds of circadian rhythm problems because of sleep deprivation, shift work, all of which can be worked with. But this is just the basics of CBT. So I'm going to give you, time permitting, I do have enough time, good, I'm doing well. I'm going to give you some strategies for insomnia. I understand that they're overly simplistic. We intend to follow up with some actual brief, very targeted, practical things that you can use. For some people, this will be enough, and for other people, you will need more. So stay tuned for hopefully more webinars, and I'll give you some resources at the end. But how do you create a strong drive for deep sleep? First of all, why would you want to do it? Well, you'll fall asleep within a regular amount of time, which is 10 to 30 minutes, and you'll stay asleep, which means that if you added up all the time that you're awake in the middle of the night, it would be less than 30 minutes. And you would have deeper sleep that you'd actually feel better. Deep sleep is how we actually make up for lost sleep. So we don't know when the body has compensated. I can tell you, so I can actually track your sleep and tell you if you've recovered, but oftentimes you can't tell. So I would encourage you not to get in the way of that system from naturally making up for lost sleep. You want it to be able to do it naturally. So one of the things I like to do is I like people to spend enough time out of bed and enough time active to ensure that they can build enough of that sleep drive. So for most people on this call, this is very busy, active physical jobs. For some people, it is at a desk, in which case activity is really low. But in both cases, we also have to look at days off. And what happens on the days off? Is it just too much of a rest and so on? Like, can we find a way to do to get a little bit more activity? And also matching the time in bed to how much time you can actually sleep. It is a myth that everyone is an 8-hour sleeper. If I prescribed 8 hours for all of you right now, I would sleep deprive some of you who are greater than 8-hour sleepers, because there are, right? Because remember I said 6 to 9 hours is normal. And I would create insomnia for anybody who is not an 8-hour sleeper. Because if you're a 6.5 hour sleeper and that's what's healthy for you, then spending 8 hours in bed would absolutely produce insomnia. And so sometimes it helps to have an expert look at your sleep to give you that feedback. And I can teach you how to do that for yourself. How can you keep your body clock in alignment? Knowing that big variability is like jet lag without the travel. That's basically it. So keeping a schedule that fits your body. And let's acknowledge that sometimes in some of your lines of work that there's going to be physical challenges to this system. Also getting natural light exposure, regular light exposure. I'm so tired of hearing about the negative effects of blue light. First of all, that research is mainly done in young adults who are light sensitive under very specific controlled conditions. There's no reason to think that in adults who have, by the way, different eyes and are not light sensitive, and none of these studies have been done in insomnia, that blue light would be necessarily negative. But what I'm trying to communicate here is that during the day, even in light sensitive individuals like young adults, we need blue light during the day. Blue light is sunlight, and we need it. because that's one of the things that tells the clock what time it is. So very, very important to get natural light exposure. Another reason why people with shift work who work nights are at risk for cancer, because it actually, well, without explaining too much, it affects melatonin levels, and taking melatonin wouldn't help with that. Also, for people who have a schedule that's difficult for their body, so if you are, for example, a early bird and you have to stay up a little bit later, using evening light can be helpful to try and stay up later. I mean, with everything you hear on the media, you might be very surprised to hear that. If you want to go to bed earlier because you're a night owl and you have to get up early, then actually reducing evening light, so making sure that that night shift is used on your phone, that you're using a setting on your computer if you're looking at your computer that actually reduces blue light, for example. TVs are fine, all that sort of stuff is fine. And then when you wake up, if you're a night owl, use lots of morning light, even if you have to get a light box, to reinforce this early awakening, and that will make it easier to wake up in the morning. In order to get rid of the bed equals wake association that happens with insomnia, one of the things you need to do is to not do wakeful activities in bed. If you don't have insomnia and you like to watch TV in bed or read in bed before bedtime, and it's part of your wind down, think of it like a cupcake. It's fine. But those sorts of activities are like the cupcake for somebody with diabetes and somebody with insomnia. So you should not be doing wakeful activities in bed. You should reserve your bed for pretty much when you're asleep or pretty close to it, temporarily. Once you get rid of insomnia, by the way, you can go back to whatever sleep habits you want. This is not a lifelong endeavor. It only takes a few weeks to get rid of it. You only get into bed when you're actually sleepy, and sleepy means that you're actually doing this. So sometimes you have to stay up a lot longer than you actually think you need to. This increases the chance that you fall asleep, and it's a sign that you have a lot of that deep sleep drive buildup. If you find yourself awake, alert, worried, ruminating, upset from a nightmare, soaking wet from a hot flash, whatever caused the awakening, get up and leave the room for you to kind of recenter. Maybe change the sheets if that's what you needed to do. And do whatever you were doing before you got sleepy that night. Was it watching TV or reading or whatever? But do it in the other room. It will return again. Sleepiness will return, and then you can get back into the bed. It takes about 2 weeks to get rid of the association. So it's a little bit annoying for the 2 weeks to do it, but that's the best way to do it. Now, obviously, for an active mind, you just count sheep, right? That probably is not going to work. Certainly getting up out of bed when you have an active mind is a good way to untrain your brain from doing it. So just go out on the couch until you become sleepy again. Some ways to prevent that: if you are somebody who go, and then you don't decompress, you don't process the day, you don't do anything like that, then you ought to set some time aside. So if you're somebody who has to process things, you can journal. If there's somebody who has to organize things, you can make lists, but do it earlier in the evening when you're at your problem solving best and processing best, not when you get into bed, because there's no distraction. And so it's easiest for your brain to do it at that time. But if you've already done it, then your brain is less likely to do it. And the hour before bed, it's best to try and protect it. You know, during the day, what I'm going to call my doing self, I'm a mom, I'm a professor, I'm a therapist. I solve problems. That's what I do. And I have to be anticipating and trying to look around corners to prevent bad things from happening and to help other people and answer questions. It's like go. In the hour before bed, I need to try and switch from Dr. Carney into Colleen and just be, you know. So I like to watch TV. That's usually my go-to. And I'm going to protect that hour before. I'm not going to do work. I'm not going to look at an email. I'm not going to do anything like that. My kids are not cooperative about that hour before bed, but thankfully they're not particularly stressful. If you have an active mind, oftentimes it means that you haven't built up enough sleep drive, because you know that sleepiness actually does override some of this excessive mental activity. So that's something to think about, how active you are during the day. And let's face it, sometimes active minds are a side effect of something else going on. So it can be anxiety or depression, could be related to trauma exposure. This is, you know, very common. And there are effective treatments for this, right? So this is something that I would definitely encourage you to pursue. Some people like to use relaxation therapy, and there's no evidence that one type of relaxation is any better for somebody with insomnia than another. So if you're like, oh my God, I hate deep breathing, or I hate muscle relaxation, but I like meditation, or I like visualization, go for it. Like whatever works. Basically, it's best done as a practice, so you do it every day, because then when you need it, it'll just be like second nature to use it. We usually ask that you don't use it at night or in the middle of the night while you're learning it, until it becomes a practice, because otherwise it kind of ruins the technique. So we get people to do it during the day first. There are many ways that relaxation works, but one of them is that if you produce a state that's incompatible from anxiety, then it basically, your body just your body and mind just become in sync, right? So if you're like really anxious and thinking about all these terrible things, and then you in that moment, especially when you're just doing that big exhale, boop, those thoughts are gone. And your physical being changes. So that's what we try and do as a strategy. Okay, so we've talked about sleepiness. We've talked about sleeplessness, insomnia. Are you sleeping healthily? What about people who don't really have big problems either way? Here's my nerdy definition. That when you're in bed, you are asleep somewhere between like 85 to 90% of the time in bed. If you sleep more than 90% of the time that you're in bed, that means you're sleepy. That's not great, right? So people who like just fall dead asleep and don't wake up until the alarm, you're sleep deprived. If you sleep less than 85%, it means you have insomnia. So just, you can calculate that with a sleep diary. I'm going to show you some sleep diaries in a moment. As long as you fall asleep within 30 minutes, I think that's great. If you fall asleep in less than 10 minutes, remember that's sleepy. You should spend less than 30 minutes awake during the night, and you should definitely be peeing less than 3 times. More than that, and there's a variety of different kinds of medical issues that might be present, including apnea, prostate, things like that, that should be checked out. You should wake up feeling refreshed. The caveat to that is that if you wake up in a deep stage of sleep, then you can wake up with sleep drunkenness, and it does take sometimes up to half an hour to shake it off. If you start getting moving within 30 minutes, you should feel alert. It's healthy and normal to wake up just before your alarm. If you wake up normally around the same time, then your body figures that out. I don't know if you, in Seinfeld, there was a Kramer would talk about this internal alarm, even set. And there literally there's actually a hormone that's released that along with somebody who has a regular schedule. It's really interesting. And given a similar amount of activity, you should start feeling sleepy around the same time every night as well. These are signs of a really optimally running sleep system. How you sleep well, honestly, it's simple. So simple that nobody likes to hear this message. We really, I mean, parents have it right. So what do we do for kids? We build a strong sleep drive with encouraging them with physical activity. We actually encourage some of that physical activity outside too, which is interesting because that's actually how we set our clock, right? So building a sleep drive, not sleeping too much, not spending too much time in bed, being physically active, setting that body clock with cues, getting into bed around the same time, getting out of bed around the same time, having 3 meals around the same time, workouts at the same time, your first light exposure around the same time, within reason, right? We don't want to live to sleep, right? We don't want sleep to be our only focus. These are just ways to help. And again, outside time so that blue light hits your eye. And having a wind down an hour before bed. I think that's really helpful. So to me, these are some of the best sleep habits that we can think about. If you have a sleep disorder based on what we talked about today, or problems with, dealing with the fallout from a trauma, depression, anxiety, chronic pain, there's help, and there's definitely effective and help available. And interestingly, with each of these 4 conditions, treating sleep actually helps these conditions. So it's really important that we come up with some good strategies and that you reach out, because nobody should be suffering. I want to give you some resources, and then I want to spend however much time we have left answering questions. If you're interested in tracking your sleep, here's a free tool I have, the consensussleepdiary.com, so feel free to use that. It will give you some summaries. So when I talk about the efficiency of your sleep, it actually would help you with that and give you the ranges. For teen sleep, I have a free treatment app that your kids can use, and it's helpful for you to not have to worry about their sleep that much. Let's see. I do have some insomnia resources. I actually have to refresh that website, drcolleencarney.com, but I usually have like some relaxation stuff and some other resources. I usually give links to providers. There's a provider map in Canada, although Saskatchewan is not rich with resources for sleep expertise, unfortunately, but there's some good information there. I'm also on Twitter, and I try to post videos from time to time on YouTube. I'm going to be better at doing that in the new year. That's actually part of my thing. So sometimes there's free resources for you on there. Here are a couple of my books that are pretty simple. One is for adults and one is for teens. The free app at dozeapp.ca, you can use it as web, but your teen won't want to. They'll want to use it on as an app on their phone, like from the Apple Store or Google. It's free, but it's Doze Goodnight Mind for teens. So those are some resources, and I think that we're planning to try and have some programming in the upcoming year for you. So I'm going to end it here so that I can focus on questions, because I suspect that the sleep needs in your particular group, well, I know they are because of my experience, go beyond the sort of overview that I was just able to give you. So thank you for your attention, and I'd love to hear your questions.
Great, thank you so much, Dr. Carney. So I am going to go ahead. There are some questions in the chat. Again, as always, guys, you can submit your questions through the questions box, or you can raise your hand and I will unmute you so you can ask your question. So first question that I have here is, can you explain how cold air would not be effective in helping to stay awake, but bright light would? I find both to be a perceived distraction, maybe helping in the short term, but only for a few minutes.
Well, I can't tell you why cold air is ineffective, because it just is. Why bright light? I can tell you that. It is blue light is one of the most powerful sources for the circadian system. And we have massive innervations in through the eye into an area in our brain called, this is my $1,000,000 word, a suprachiasmatic nucleus, which directly is associated with our alerting signal. So light, and it makes sense because we're diurnal creatures. We walk around during the day. It's a sign of alertness. It enhances alertness. But there can be eye fatigue, and then you can feel fatigued afterwards. So it's sort of a short term, as the person asking the question, it's a short term fix, not a long term solution. And none of them were that I gave, none of them.
Do night owls have like a different circadian rhythm? Does their alert signal trigger at a different time?
What an amazing question. Yes. That's such a great question. So if you imagine that kind of curve, that entire curve is moved over. Okay. So, and the curve is flatter in the morning, and all my night owls are like, oh my gosh, yes. So it takes longer for a night owl to start feeling awake than it does for somebody. Most of us are somewhere in the middle. Like, I don't know, about 70% of people are somewhere in the middle in terms of being a night owl or an early bird. But our true night owls, it takes a long time for them to become alert. Now, interestingly, that curve that goes up in terms of going towards the peak is pretty sharp, actually, in the afternoon to early evening. So if you've ever noticed teens suddenly, like, they want to start doing their homework in the early evening and they get criticized for it. But that is actually where they start feeling a peak of some sort in terms of, or a little rush of alertness. So it's actually a perfect time for them to be doing it, physiologically speaking. And of course, everything is shifted over later. So for an early bird, if you're wondering, the curve is different too. So the curve is moved the other direction, and on top of that, there is a sharp incline in the morning. So they feel alert almost immediately. And if you've ever seen an early bird, they just rush around like crazy. And almost feel like it's almost like they're very productive in the morning. Okay, so high alertness, and then they kind of peter out. Then the line starts flattening again as it's still going up towards its eventual peak in the evening. And so they get most of their work done early in the morning until the early afternoon. So yes, the curves look different for morning and evening people.
Clinically, how do you identify a short versus a long sleeper?
That is an excellent question. So clinically, we would have people collect data on their sleep, and we would track it, and we would track sleepiness, and we would track average sleep times, and we would take a history. So people who are actually short sleepers and actually long sleepers, it is genetic. There's a genetic loading for it. And you would see the pattern from childhood, and you would not see negative health effects in the people who are able to follow their schedule. And you would only see problems when they deviate from it. So for example, if you are a short sleeper and you're trying to spend 8 hours in bed, and you see insomnia, and then we match your time in bed to your sleep production, and the insomnia goes away, but you also feel really good, we have our answer. If you're a long sleeper and you're walking around sleep deprived, we use something called sleep extension. And if sleep extension gets rid of the sleepiness, then we also have our answer. So we do some trial and error to figure out whether or not you're a short or long sleeper. A lot of times people have beliefs about whether or not they're a short or long sleeper, and it may or may not bear out, but we do it systematically.
For shift workers, is it best to try to sleep all at once, or is it okay to break it up and have 2 sleeps?
So let's start with the caveat that I can never give you good advice for shift workers. So we can't pretend that shift work is not dangerous for the body. So as long as we can understand that, then I can answer this question. So it is never helpful to break up sleep into more than one chunk. There's a lot of garbage on the internet about biphasic or polyphasic sleep, so breaking it up into pieces. That is garbage, and it's a misunderstanding sleep science. If you're asking me if it's okay to do it that way because that's what's working for you, what I typically see is somebody who is working a shift, who gets in from their shift and is able to sleep, but not for a tremendously long amount of time. And so they feel the need to nap pre-sleep in order to get through that other shift. And that is a perfectly reasonable strategy to compensate. So is that a healthy sleep habit? No, but we're trying to consider a good strategy, a good 24-hour strategy. So for some people, if they can't get the sleep that they need in the morning and they need to have a long nap before they're going into work in order to function, then that's a perfectly reasonable strategy to have.
Okay. Do you recommend reading in bed before sleep, or would reading in a chair in the bedroom be better?
Well, it depends. If you have chronic insomnia, then absolutely not. No, don't read in the bed. Preferably don't read in a chair in the bedroom either if you have chronic insomnia. If you don't have chronic insomnia, you can read wherever you want, whatever would be enjoyable for you.
Has the pandemic affected our need for sleep in any manner? I was wondering if sleeping a little bit more than normal might be helpful to deal with the huge stresses of the pandemic.
Well, sleeping longer never helps with stress, right? Because it actually can become a stressor, because remember, sleeping longer can actually increase risk for mental health problems. So when we're talking about sleep need, we can always measure sleep need by how much growth hormone is released, but I'm not going to walk around taking blood work from everyone. So I'm going to look at the efficiency of your sleep. So I'm going to look at what proportion of the time are you sleeping while in bed, which you can calculate for yourself using the consensus sleep diary if you wanted. So most people have not had an increased sleep need during the pandemic because for most people, they are less active and they get less light exposure during the day as well. So for many adults, they've become sleep dysregulated. And we've seen a lot of a greater increase in sort of low-grade depressions and anxiety. And so we're just seeing, and people getting into bed for boredom. And not having to get up for commute and so on. So they actually are spending more time in bed. So none of that is great, right? So increased time in bed is associated with mental health stuff. So have we increased our sleep need for during the pandemic? For most people, no. For people who work in medical or emergency situations, the sleep need has become greatly increased because there are long shifts, more shifts, and so we're seeing a lot of sleep deprivation, a lot of burnout, and an increased need for sleep. So it depends. Stress doesn't increase your need for sleep. Stress can negatively impact your ability to sleep, so stress management might be important. Interestingly, we did a study, and there's been 2 other studies that confirm this, that teens are sleeping better during the pandemic. And one of the reasons is that they are kind of sleep deprived because they are, with puberty, the hormonal, there's a hormonal shift towards night owlness, and which you probably have noticed if you have teens or when you were a teen. And so if you can't sleep earlier and you can't get up earlier, but you have to because of school, you just lose sleep. Like there's not a way around it. And so, but teens, because they don't have their commute, because they can get online without having to get read, like they can have their camera off, they just basically roll out of bed and get on camera, that we have found that teens are sleeping better because they get a little bit more sleep. It's sort of interesting.
How bad is it to hit the snooze button every morning? And if I do snooze, what's the maximum recommended time before getting up?
I can't really tell you that. If you hit the snooze bar the same amount of time every morning, then theoretically it shouldn't have a negative impact on your circadian system, your body clock. It is a cupcake diabetes situation for insomnia. To use the snooze bar is to decide that you're going to subtract however long the period is for the snooze bar. So if it's twice, usually that's about 20 minutes for people, that you've decided that you're going to subtract that amount of quality off your sleep for the next night. Now, some people will be like, worth it, but can I argue against that? It is impossible to produce quality sleep at that time in the morning. So your alerting signal is increasing, and so the types of the sleep that you're going to get are light transitory sleep or REM sleep, none of which is restorative. So all of your growth hormone, all of your compensatory sleep has long been done. So you are sacrificing quality sleep that night for crap sleep right now. That's the clinical term. So from an insomnia point of view, I don't ever think it's worth it. But if you don't have insomnia, do whatever you want.
Those lucky people. How long does it take to develop good sleep habits?
How long does it take to get? I mean, today, right? Like you can literally have good sleep habits today. If you're asking how long before you would see the benefits, it's kind of like exercise. I mean, like you should notice things even the first week that you start having some regular habits. And, you know, track your sleep, like keep it honest. And if your sleep doesn't improve, even though you're doing some good habits, then by all means, like talk to somebody. Because if you're doing everything that you can to sleep well and it's still not helping, I'm gonna give you a good example. Sleep hygiene is the #1 disseminated treatment on the internet. It's the main thing that you're gonna get at a doctor's office. Sleep hygiene, though, you should know, when I'm gonna do a research study and I need a control condition, a placebo condition, that's what I use. Because I know, because everyone's heard of it, that they will think that it is going to be effective. But I also know it won't be effective, so it's a perfect placebo for me. So we have all of these people following sleep hygiene, cutting down on caffeine or cutting out caffeine and you know, exercising, but at a certain time, and trying this and trying that, and having some milk before bed, and stopping smoking, which actually makes insomnia worse while you're quitting smoking. Not that I don't think you should quit smoking. And it doesn't work. And so all these people are running around trying to make these changes, and they're so frustrated because it's not working, and yet that's what they're getting. And so when it comes to good sleep habits, the ones that I mentioned, if you're not seeing results right away, then don't blame yourself. Never blame yourself. Talk to somebody else, because it could be an underlying sleep disorder. There are sleep disorders we even talk about that we can, you know, and if that's what's causing it, then you should be getting treatment for that.
How many hours of outdoor direct sunlight do we need? How much?
That's a great question. We don't know the answer to that. So there's lots of people outside of the area of sleep who work in mathematical modeling have tried this, but it seems to be individual differences. And I have to say too, this is why some of the blue light research is really overblown. As we age, our pupils narrow. As we really age, there's the starting of cataracts that change how much light can get in. And there are just so many different things that happen, too many sort of variables to control for to know how much would be important. I can tell you that when we're using light therapy boxes, we usually use 20 minutes of concentrated blue light. That would be equivalent to 10,000. I mean, it would be equivalent to, I would say, an overcast day, but not a particularly sunny day. And it's peripheral. It's just, you know, it would be like, there's some that are on your phone that you can do. And so it was Princess Leia, sorry. It would be like the light is here and I'm like busy, you know, eating my breakfast or whatever. And so it's, as long as your eye can see it out of the corner of its eye, it's peripheral vision, like it's going to have an effect. So I don't have a great answer for you for that. We're working on it, but it doesn't, I mean, we usually say like a good 20-minute walk would be pretty great in the sunlight.
So it was mentioned that there were strategies for shift workers or on-call workers to help with the arousal of these situations. Can you elaborate a little bit on that?
Well, I hope to be able to give a talk about that. I mean, you know, some of the strategies that we already talked about would be effective, but really, it depends. So some people, the on-call has to do with a cumulative effect of trauma exposures too, right? Of seeing like pretty upsetting things. So it really depends what the nature of it is, but generally speaking, what we're going to do is we're first going to explain what on-call sleep is, and that it is impossible to sleep well under those conditions. The body knows somehow that it shouldn't get too deep in terms of sleep. And so have you ever, like when you have something really important, like a flight or something the next day, how you're just constantly like waking up all through the night because you're just, and you have an alarm set, like there's no reason, you know. So usually we'll use some relaxation, but also some cognitive techniques to talk about whether or not the level of vigilance that we tend to use when we're on call is necessary. And we'll use some counter arousal strategies, some relaxation, some mindfulness strategies to help with that. So it's a little bit more complicated. It's a little bit beyond the scope of what we can talk about right now, but some of the strategies are the same as what we saw.
Okay, so I'm just going to finish up with the last question, then we'll do our wrap up. What's the best amount of time for naps if they are needed?
Well, the best amount of time is a nap that makes you feel restored. So for some people, they literally do a little 5-minute power nap. Naps, so certainly naps that start getting close to 90 minutes are sleep disruptive for that night in terms of quality. You'll see, make sure that your nap is 15 minutes or less. If you're using it as an alertness strategy, then, and you don't have insomnia, then I think setting a 15-minute timer seems overly perfectionistic if you really want to feel better post-nap. I mean, ideally you would wake up naturally and just set a timer for how long you don't want to sleep for. So if it's like, well, I don't want to sleep more than 90 minutes, I mean, that seems overkill. Then, but I need to sleep before I go into my shift. I suspect that one of the early questions, that's the scenario that person is facing. Then I don't think you should start limiting your naps if the naps are helpful for you to function pre-shift. So again, that's something that we'd have to spend a little bit more time on, but yeah.
Okay, wonderful. Well, thank you so much for being here today with us, Dr. Carney. Hopefully we will have an opportunity to have you back again. For everybody that's listening, there will be a quick survey at the end of the town hall. We hope you'll take a few moments to complete it. SIPSRT hosts monthly town halls on topics specific to PSP. So if there's something you want to learn more about, tell us that in the survey. Also tell us if you'd be interested in more information about the sleep. If you'd like to see more sleep sessions with Dr. Carney, let us know. We will be hosting a launch of the Families Matters Network on January 27th. This is an interactive session, and it is an opportunity for family members of PSP to help create the future of family support. There are more details about the event on our website, so spread the word to the families out there. There will also be details in your follow-up email with the recording tomorrow. Once again, I want to thank everyone for attending today, and I want to remind everybody to stay safe and take care out there. Bye.